Welcome to Doc Podcast. My name is Abbas Shafi, gastroenterologist.
And I'm Rob Hoyer, medical oncologist.
This is a podcast about lifestyle medicine, disease prevention, and longevity.
This podcast is provided for informational purposes only. It is not medical advice. Please consult your physician for individualized therapies. Please also check out our website at doc2doc.health. That's doc2doc.health. There you can leave us messages, make suggestions for future episodes, and ask us questions. And now, on to the show. Hi, everyone. Welcome to the Doc to Doc podcast. I'm Rob Hoyer, a medical oncologist, and I'm joined by my good friend and colleague, Abbas Shafi, gastroenterologist. Our goal is to enable individuals to be CEO of their health using the tools of lifestyle medicine. And we are just so excited to share this information with you. And today we're going to be talking about intermittent fasting, which is a huge topic. And I'll let Abbas kick it off.
Fasting has been a part of human evolution since the mankind has evolved. It started with hunter and gatherer, and not because of the choice of health, but based on the environment, season, as well as a technique for survival. This not only happens to human, as we see many other animals hibernate, which is a form of fasting, like bears, as other animals they do. So it's all depend on the season, condition, as well as possibly for some health reason as well. After human lived in a community, then we start participating in ritual and religion. Then fasting became a part of this phenomenon in the whole world. So the ritual and fasting for religion has different purpose. It has more of a meditation, as well as appreciating what you have and sharing your food with less fortunate than us. However, in recent decade, due to change in our lifestyle, increased stress, as well as abundant food, we are facing the diabetes, obesity, hypertension, fatty liver. So the fasting has become a part of health management. As 2/3 of the world every day goes hungry at night, 1/3 we are overfed and struggle with excess weight. Today's fasting has become popular for many different reasons, as weight reduction, disease management, preventive cancer, as well as longevity. There are many different ways to fast. Individual is based on their medical condition, history, as well as availability of the food. So they choose the proper style or fashion for their fasting.
Okay, so let's talk about a few different types of fasting. So the first is alternate day. So this is basically what it is, alternate day. So fasting on one day and then not fasting on the next day. So one of the more evidence-based fasting strategies, there was one study that looked at 32 individuals who consumed 25% of their calories on the fasting day, and then alternating with this what's called ad lib, or eating as they wanted to on the following day. And they did that alternately. And over the 12 weeks, the fasting group lost 5.2 kilograms, so just about approximately 10 pounds compared to the control group. Although criticism of the study was that it was a fairly short study. So a study with 100 individuals with obesity over 1 year did a somewhat similar strategy of 25% on the fast days and then 125% on the feast days. And they compared that group to a group that just had 75% of their recommended daily calories. So they were dieting continuously. And there was another group that had no intervention. They just ate normally. And at 6 and 12 months, the mean weight loss was similar in the alternate day fasting versus the daily calorie restriction. So it does call into question if this alternate day fasting and the way it was done is effective. So another method, time restricted feeding. This is probably one of the more popular currently. So basically, stopping eating at a certain time each day results in a prolonged period of fasting. And importantly, water is still consumed. So it's important to hydrate during this time if you're fasting. So the fasting can be 16 hours, can be 12 hours, 18 hours. Probably the most commonly, the ones I've seen are 16 or 18 hours. So it's thought that this may improve insulin sensitivity, might have some anti-inflammatory effects. And also this does allow somewhat of the alignment of feeding with the circadian rhythm. So the idea is that during the day, when you're more active, you're eating. So for example, breakfast and lunch, and then maybe fasting after lunch. Or some individuals will skip breakfast and then eat lunch and dinner. There's different ways to do this. It's important to note that long-term studies have not showed efficacy of this method of fasting.
Rob, on this, when I was studying that, I noted that there's no significant difference from 16, 18 to 25 or 32 hours of fasting. So seems like 16 to 18 is as good as longer interval for fasting. So as you mentioned, that we need a long time study to show at least a year or 2 years to see if it makes any difference. But I think following the circadian rhythm and eating 8 hours and then fasting 16 to 18 hours, I think seemed like it was a better, more reasonable method to do.
Yes, I agree. I think this strategy makes sense. Evidence is just, as you said, is somewhat limited. So we don't really know exactly. And this may also work differently for different people. Someone may respond well to a 14 or 16 hour, someone else better to an 18-hour fast. So it's
depends on of course, the lifestyle and where you are, work, the type of the work you do as well. So any of these things have to be suited to the individual lifestyle.
So here's a specific diet, the 5-2 diet, that's been studied. And so this is kind of interesting. So eating normally for 5 days, and then 25% of the recommended calorie intake for the next 2 days. So mixed results with this. There was a study published in 2021 that comparing the 5-2 diet to multi-component weight management. So basically a sensible dieting program showed pretty similar results in both. There was maybe a little bit of improvement in the 5-2 diet group, but not very much compared to the recommended weight loss group. Another study with 44 patients with what's called fatty liver disease, which is a very common condition. And so adherence to this diet did show weight loss and improvements in parameters associated with obesity, as well as what's called hepatic steatosis, the amount of fat in the liver. Liver enzymes got better, triglycerides, and inflammatory biomarkers. It should be noted that this was a group that had fatty liver disease, so perhaps they were more motivated to participate in this program and fast according to the recommended 5-2 diet. So there does appear to be some potential for this, but evidence for this fasting strategy is also pretty limited. So fasting mimicking diet, and this is one that we'll talk a little bit more about in the discussion. So basically what this is a diet that tries to achieve similar results to fasting, and based on the different factors in the blood called insulin-like growth factor and ketones. So the idea is to generate ketosis, but not have to fast completely. So most of these diets are about 600 to 800 calories a day, and they can go on for a few days. There have been studies that have shown the safety of these, and they're being studied in other settings. So this is one here by Min. I mentioned in this discussion, looked at 3 months of an unrestricted diet, compared to the fasting mimicking diet for 5 days per month for 3 months. And patients who did individuals who did the 3 fasting cycles had better body weight, lower body fat, lower blood pressure, and decreased insulin-like growth factor 1. There were no serious adverse effects reported in the fasting group. So there's a bunch of research being done in cancer, diabetes, cardiovascular disease, and aging. And we'll talk more about the fasting mimicking diet in our discussion as well. And then wanted to talk a little bit about a paper that was recently published regarding a Chinese study, intermittent calorie restriction, which is really essentially a fasting mimicking diet on type 2 diabetes. Kind of interesting study. And I'm just going to pause here. We'll go ahead and we'll talk about this in a second. So this is a paper that was recently published. It's a Chinese study that looked at essentially a fasting mimicking diet in individuals with diabetes. I thought it was pretty interesting because it actually looks at remission of or reversal of diabetes, which is a subject that is quite controversial. And the question is, can individuals with diabetes ever go and become non-diabetic anymore? And so I'll save my comments on the study for the end here, but we'll just go through the abstract. And this is the entire paper. We can just go through it here and look at what they studied. So this is looked at participants aged 38 to 72 who had diabetes between 1 and 11 years. And they mentioned the different, had body mass index of normal to above 25 is considered overweight. It should be noted that there were not very many obese. Obesity is classified as body mass index over 30. So not very many obese individuals in this study. Most were either normal or overweight. And they looked at this diet. They randomized the patients to either what's called Chinese medical nutrition therapy or control. And they looked at what's called the A1C, which is a measure of glucose on hemoglobin. Hemoglobin is the major component of the red blood cells. And so we can actually estimate the blood sugar of an individual over the past 3 months with this A1C calculation. It's pretty cool, and it's commonly used now to both diagnose diabetes and to track it. And so they looked at having an A1C level of less than 6.5 for at least 3 months after stopping diabetic medications, and also looked at some other parameters: blood pressure, quality of life, weight, and medication costs. And their study did go on for a year, which I thought was really quite interesting, and I commend the authors for extending their study for that duration. So the top line summary here is that individuals who had this diet that they would do for 5 days, and then they would come off, and it's here. So they were fasting for 5 days and then off for 10 days and fasting again. So it's a very intensive diet, off for 10 days, on again, off the fast. And the individuals in the active group of the study were on this diet for 6 times over a course of 3 months. So it's a very intensive fasting program. What this diet was basically what we would think of as what we would call a fasting mimicking diet. So they had different porridges that they ate, different rice components, and there was a variety of we would often call these shakes. Would be, I guess, a common. They don't call it a shake, but it's essentially these powders and different ingredients in this. And the calories are about 840 calories per day for that 5 days. And so go back up here to the summary. So the individuals who did this, 47% of them attained remission of their diabetes, whereas only 2.8% of individuals in the control group, which is a healthy diet recommendation, had remission of their diabetes. So kind of an interesting study. It does suggest that with the right intervention, maybe diabetes is reversible. And so that's kind of an interesting. And at 12 months, 44% of the participants were in sustained remission with A1C of 6.3%. So kind of an interesting study. I have a few comments that I'll make here, and we can go through those in just a second. Okay, so a few comments about this this study. Really interesting. I'm sure this will serve as a subject for a future investigation. Would love to see a investigation in a Western population and see if this is repeatable. Really very, very interesting. They mentioned in the study an odds ratio 31.3. So that means that the individuals who had the fasting diet had 31 times the likelihood of having remission of their diabetes. I've never seen an effect size or what's an odds ratio that high. It does seem to be really too good to be true. Perhaps the individuals in the fasting group are highly motivated. So that's something that is probably.
But regardless, this Rob, I think that's even is a study is too good to be true. But I think it can develop a sort of a sample that we can follow. When you look at today's diabetes and fatty liver, when you look at for example, in epidemiological study of Hawaiian, if the Hawaiian they go to follow their ancestral diet early enough, especially below age 35 and more effective 25, they can remain non-diabetic and live a healthy life. However, if they continue to eat more of a Western diet, which they're not accustomed, majority, probably over 90% will become diabetic. Today, we see in fatty liver in Middle East, the area that United States has been since 1980s, the fatty liver is becoming a pandemic there. So once you get the obesity, fatty liver, then follows by diabetes, hypertension, and unfortunately with heart disease and stroke. So I think it's still some hope that if you decided even not completely fasting, you can do fasting, mimic diet, and there's at least maybe not as good as this study, or maybe not everybody as motivated as them, still be able to reverse or slow down this metabolic syndrome.
Yeah, I think that's a very good point, and it does provide some evidence that there is hope, and that diabetes may not be a one-way street. I think that's really very key. The other comments I had was adherence was very high, and 88.9% completion. So probably a very selected population. A small study, which goes without saying. So we need a larger study to really study this. And also, the researchers comment that individuals who took their diabetes medicines, they had some individuals on 3 or 4 different diabetes meds. They commented that they took those meds during the 800 calorie a day fast, which I thought was kind of interesting. I don't know if we would be that aggressive if we did this study for example, if we did this in our clinic, would we be that aggressive in continuing those meds? They don't comment about hypoglycemia or other complications individuals had. I think that's important information that we probably need from the study. But
of course, the key thing about diabetes and individual people will take numerous medication, hypertension or diabetes, they need to really watch out, because during those even restricted calorie diet, if not completely fasting, both blood pressure and sugar can come down, and consequently could have an adverse reaction for the individual. I think the fasting should be individualized. Overall, when I look at all different type of diet, I think if you're following your circadian rhythm, and if you look at the ancient cultures, mostly as you get up, eating during the waking state for 8 hours, then fasting during the night, I think is the beneficial. Some other beneficial of the fasting is, as Rob mentioned, is increasing human growth hormone, decreasing insulin level, and improving cell repair. And some of the new studies shows improving gene expression and may help with the longevity. Some of the other health beneficial is, of course, everywhere looking for losing weight, better glucose and diabetic management, decreasing inflammation, improving brain and heart health, improving longevity, and decreasing aging. And this may cause a decrease in cancer. Some of the side effects of the fasting that every individual should be aware of, one is hunger. The common hunger is mostly first 2-3 days. So for example, in different religion, they do fasting for different duration. In Islam, they fast for 1 month, and I've done that in the past myself. And the first 2-3 days is the most difficult, feeling hungry, tired, and for prolonged, especially if you don't drink adequate water, which is they do not, nausea, constipation, bloating follows. For the individual, they have high blood pressure, which take medication. They need to watch out for the low blood pressure, as well as the diabetes, or even the individual that are very sensitive to carbohydrate load. They can have a low blood glucose. And when we go to the ketosis stage, we can have a brain fog and some confusion. Other prolonged fasting, if you do not drink adequate hydration with its kidney stone, in a female can change in menstrual cycle, prolonged time, peptic ulcer disease, dehydration, and bad breath. The bad breath is mostly that's when our carbohydrate metabolism slows down and we go to ketosis as we release ketones, and consequently we have expelling ketones, and that's one of the causes of bad breath and other things, of course, dehydration from the mouth and dry mouth. Irritability, sleep disturbance, all of those things should be also keep an eye on. The people that they want to do this prolonged fasting, they should really consult their physician, particularly if they're diabetic, they have high blood or low blood pressure, they're underweight, they have seizure disorder, people that take multiple medication, have history of eating disorder, sometimes that can cause flashbacks and cause returning to eating disorder. Women that try to conceive, they should not fast. Pregnant or breastfeeding female, and people with heavy menses, they can feel fatigue, lightheaded, as well as the people with end-stage liver and kidney disease. So as we discussed before, so I think fasting is you want to stop it at here. So as today we deal with this metabolic syndrome, which we have discussed before, and we have a podcast on it. And this is not only an American issue; it's become a worldwide issue. As I mentioned, we need a solution out, and I think experiencing avoidance from the food, which is fasting, that is tailored to individual, I think is a new hope. Hopefully we can decrease the meds, decrease the weight, and increase longevity, as the study you mentioned, that maybe there's some hope for the individual that they're early in stage of diabetes. You can reverse it and maintain the health and prevent from all diabetes and hypertension complication.
I agree. We talked about this extensively in our episode on the metabolic syndrome, and I encourage the listeners to check that out, because we go into the whole definition of what metabolic syndrome is and how it can lead to diabetes and a number of other issues. But it's kind of interesting that fasting has gotten so much popularity, and yes, it's hard. I think that's one of the things that folks that are concerned about in looking at a fasting strategy. And but it really is that antidote for what we've called the comfort trap in our industrialized high-tech society. And we have so much abundance, which is great. We have all these things, foods and everything we could possibly need, but we're getting too much, and too much calories, too much processed food, is leading to diabetes, obesity. And as we've talked about obesity and how specific foods probably lead to obesity, one can, when you're not fasting, eating those foods can be very helpful. But if you have a medical condition or pre-diabetic, fasting is probably helpful. I feel pretty comfortable saying that with the evidence that we have currently.
Yes, and I think this is going to be a national crisis. This, if we do not take care of this, heads on, because as you know, still heart disease is number one, as you and I see. We see cancer in younger individual, and that's because of this processed food, fast food. So I think we have no choice to to at least have the first step, and the combination of other things, exercise, stress management, sleep, for longevity. So I think maybe this is an easier step to sort of put the puzzle together, and with increased activity, and when people well-being of their weight, then exercise more, and hopefully they have better sleep, and hopefully they can manage their health, and then again, as we always discuss, they be the CEO of their health, and they can manage the medicine, and that, I think, it's a step toward the same goal.
So I think it'd be fun to do a second episode, a follow-up, where we can talk about some of the specifics, and maybe we talked a little bit before this episode, before we started recording, about potentially doing a discussion about how to do this, how often to fast, how to do it, and what strategy to pursue. It seems like that's one of the most confusing things, is how to really do this. Do you do it once a week, twice a week, 16 or 18 hours? And what, can you exercise during this? There's a lot of questions that remain unanswered.
Right. I think this simplification is, for each individual, is the key things. And I think it'd be nice to get some comments from the viewers to tell us what they feel. And I think we can discuss it more. But I think, as anything else, the first step is important. I think just trial it to see which one works best for you, what's best for your family. The people that have children is very difficult than people working heavy duty machinery or versus office. So I think it is doable. You just need to tailor to the individual and do the baby steps, and hopefully we are in the right road for a healthy life.
So as I was researching this, I did get on a few websites, and I was kind of intrigued by the fasting mimicking diet. So I ended up buying it. I have it at my house. I haven't started it yet, but I'm going to try to give it a go here in the coming weeks. And I'll report back to everyone and see how it goes. It's a 5-day fast program of, I think it's like 700 or 800 calories a day, something like that. So I was going to give it a shot. Just in full disclosure, I have no relationship to this company or anything like that. I just went out and bought it.
That's great. So it's good to see your first experience. But I have fasted in the past, and I tell you, the first few days is tough. But I think once you get into it, and you feel benefit, and you feel how even 5 to 10 pounds, you get lighter, and then you feel better in your skin. And I think overall, I think the decreased inflammation and all of that will definitely as good start to do. And then as is for the individual, some people they have more freedom in the weekend. They can fast, or some people they can do during their working hours if their job is not that demand excess of calories. So that'd be great. So I think the next episode we will discuss and dive into this in a little more detail.
Awesome. Well, we'll have our links to our emails and in the show notes, and we'd love to hear your comments. We'll put this episode up on the website here, and we'd love to hear feedback. So questions, comments, things we could cover, topics, let us know. We're here and want to share what we know, but also what we don't know. And we want to learn from you, because there's a lot of information out there. So let us know.
All right. See you guys in the next episode. Thanks, Rob.
Thank you.